If you guys have your medicine interviews coming up, you need to know about the privatization of healthcare as one of the hot topics that you could mention in your interviews. The arguments to do with privatization, what are the pros, what are the cons, and how does it relate to some of the ethics behind this? First and foremost, patients have a lot more autonomy. Why? Because now they have a lot more options, and these options might just lead to greater satisfaction. And then, with a lot more patients going towards private areas, that then relieves the pressure of the NHS, reduces waiting times for a lot of stuff as well. Some of the cons. So, one of the cons is how actually efficient is this? Because with a lot of these private companies, they tend to prioritize profit rather than preferable patient outcomes. And with those concerns, we also have a concern of generally just the care of the patients. The other thing is an issue of inequity, because the privatization system then leads to a two-tier system, which basically just favours the wealthy. And finally, there's a lack of transparency between the private companies and the NHS, which does create a lot of issues. Then if you look at it from an ethics point of view, we talk about autonomy. Patients have a lot more choice. But really and truly, do all patients have a lot more choice? No, because that automatically just limits access for the poorer people to those private services. Then we speak of beneficence and non-beneficence. Well, generally, these private companies are at greater risk of just prioritizing once again that profit over the patient care. So if you're enjoying these videos, stay tuned. There's a lot more videos coming out, and stay tuned on the ebook as well.